Hello there, everybody. Welcome. This is Ask Dr. Bob, and this is where you ask me, Dr. Bob Gabe, the Chief Scientific and Medical Officer here at the American Diabetes Association, your questions. And for those of you that have been with me on this journey, uh, each month we pick a different topic. Sometimes it's around what's happening in the world, and sometimes it's, this month it turns out this is Thyroid Awareness Month. And so we thought this is a good opportunity to talk about the thyroid and how it relates to diabetes. For those of you that are new, please throw in your questions into the chat. I've already gotten a bunch of questions from you, and so I'll start with those. And if you like the program, tell your friends, and also follow me on social media, where I share all sorts of hopefully interesting things that relate to diabetes that can be helpful for you all. So you can find me on Twitter at Dr. Bob Gabe. You could also find me on Facebook and LinkedIn. And so, without further ado, Thyroid Awareness Month. Let us talk about the thyroid. And the first question, which is probably good level setter, is are people living with diabetes at higher risk of developing thyroid disease? And it turns out, yes, people with type 1 diabetes, very much so. And we'll talk more about that in a moment. People with type 2 diabetes, remember type 2, 90% of people with diabetes, type 1, 10% of people with diabetes, about 1.5 million people. So type 1, yes, much higher risk of developing thyroid disease. Type 2, not clear. It may be true, but it may not be. It probably is not much of an increased risk at best. But thyroid disease is fairly common. And so, there are a lot of people with type 2 diabetes, and a lot of them have thyroid disease. So that's why this is a good topic for us to talk about. And one of the questions somebody asked was, so it turns out there's a difference between men and women, of course, in many things, but when it comes to thyroid disease, in general, uh, thyroid disease is much more common in women than it is in men. And so we're not entirely sure why, but that very much is the case. And doesn't mean that men can't get it, but it's just much less common. So uh, the the next question is, what is thyroid disease? And let's start with what is the thyroid. Um, well, the thyroid is a gland that makes hormone named thyroid hormone, and that lives in the neck. It's like a butterfly-shaped thing, relatively small in size. Uh, you can sometimes see it as you swallow. It moves up and down, separate from the Adam's apple. So just keep that in mind. Uh, and that little gland produces one of the main things it does is it produces a hormone called thyroid hormone. And so when we think about thyroid disease, like many hormonal problems, the issues are either making too much of the hormone or not enough. You think about diabetes being a hormonal disease in large part. And so for people with type 1 diabetes, they the gland that is making their hormone is the pancreas, and it doesn't make insulin over time, and that's what defines type 1. So thyroid gland in the neck makes thyroid hormone, and the problem can either be too much thyroid hormone or not enough thyroid hormone, and they both cause sort of different symptoms. And you could almost think of thyroid hormone and the thyroid as the thermostat for the body. So when it's turned up, everything is revved up. Uh, uh, People that have an overactive thyroid or hyperthyroidism hyperthyroidism. They can be jittery. Sometimes their hands will shake. If they put their hand out, you can be able to see like a little tremor. Uh, they feel warm. Uh, their GI tract moves faster, so they can have diarrhea. And so everything is revved up. The thermostat is revved up. And hypothyroidism or low thyroid, the opposite, everything slows down. So they tend to be cold compared to other people. Their reflexes are slower. Uh, they can be constipated, feel fatigue, all of those types of symptoms. So, uh, hyper and hypo, or overactive and underactive. Um, so the next question is, how is thyroid disease treated? Well, it depends whether it's overactive or underactive, and we'll talk a little bit about what causes it being overactive or underactive. But overactive, their treatments basically to either slow down the thyroid through tablets, or sometimes taking out the thyroid altogether if it's really overactive and has gotten enlarged. Or one can give radioactive iodine. So it turns out that iodine, the reason your body needs iodine in large part is the thyroid hormone is made with iodine in it. And so, uh, uh, if you and the thyroid is very good at concentrating all the iodine in your diet and sucking it up. So if you give radioactive iodine, the radioactive iodine goes to the thyroid and it kills off the tissues. So overactive thyroid, some way of either slowing it down or removing that problem by removing the thyroid or in essence killing it off. And underactive thyroid uh, is replacing thyroid hormone. And unlike insulin, which requires an injection and figuring out the right amount based on all sorts of things, replacing thyroid hormone is much simpler. It's a tablet taken once a day, and it replaces that thyroid hormone. And one can measure a blood test to know whether it's the right amount, and it's in essence much simpler to replace compared to insulin. Okay, so that is that question. Let's move to the next one. So, what are the symptoms? And I already talked a little bit about this. With an underactive thyroid, constipation, fatigue, dry skin, and weight gain. Uh, and with an that's an underactive thyroid. And for overactive, feeling warm, palpitations, feeling like the heart's racing, a tremor, shakiness, and weight loss. Now, one of the things that's important to think about here, and this is very common, is there are a lot of people that are feeling fatigue and are gaining weight. And it's tempting to think that that could be the thyroid, and sometimes it is, but most times it's not. And so, how do you diagnose thyroid disease? And it's pretty easy to do. You really just measure thyroid hormone, and something that gives an indicator of the body's thyroid hormone status, and that's a measurement called TSH. And measuring TSH pretty much tells you whether you have enough thyroid hormone or not. And so it's easy to diagnose in essence. Okay. So, is thyroid disease preventable? Um, Not really, I would say. It's not preventable. Yeah, I think that's the simple answer. Uh, but what is important to know uh, is that, as I said at the beginning, people with type 1 diabetes are at higher risk for developing thyroid problems uh, because many thyroid problems are related to autoimmune disease. So, One of the most common reasons for the thyroid to be underactive is autoimmune destruction of the thyroid gland. People make antibodies to their thyroid. It kills off the thyroid. They don't make thyroid hormone, and they have an underactive thyroid. They need to be treated with a thyroid hormone tablet. Well, type 1 diabetes, as you know, is an autoimmune disease, where in that case, the immune system attacks the insulin producing cells in the pancreas. Turns out if you have one autoimmune disease, you're at greater risk for other autoimmune diseases. And that's, sort of almost like a rule of thumb, where crosses many autoimmune diseases. So, all that is to say, people with type 1 diabetes are at higher risk of developing thyroid disease. And as a result, we recommend every year for someone with type 1 diabetes to get that TSH blood test that will screen whether their thyroid is underactive or in some cases could be overactive. And so it's a simple test. You can make sure to ask your healthcare professional, am I getting screened for thyroid disease if you have type 1? If you have type 2, not recommended to screen everybody. Okay, so it is Thyroid Awareness Month for those of you that are tuning in late. We've talked about the link between thyroid disease and diabetes, particularly for type 1, less of a link with type 2. We talked about what the symptoms are of the thyroid either being underactive or overactive. Uh, and so the next question is, does thyroid disease affect a person's insulin and blood glucose level? Well, it can in a small way, and it's a little bit complicated, but I would say the simple answer is yes, maybe. What it really affects is that is related to diabetes is one's cholesterol. So, an underactive thyroid will have a high cholesterol. And so, sometimes when we see somebody having a high cholesterol value, we may want to check that their thyroid is normal. Okay. Next question is, how should people effectively manage their diabetes and thyroid disease? And so the key is getting this TSH blood test. And with that, you can tell whether they're getting the right level of thyroid hormone and then, be able to adjust that. And thyroid hormone levels change very slowly. So that test, even for somebody that is taking thyroid hormone tablets as replacement, doesn't need to be checked any more than every 6 weeks. If you make a dose change, wait 6 weeks to check it again. And again, as I said, for screening for people with type 1 once a year is enough to be able to detect in most cases whether someone's developing thyroid disease. Um, One other thing I should mention about thyroid disease and diabetes in general is around pregnancy. So it's really important that someone's thyroid levels are normal during pregnancy and really before becoming pregnant because having good thyroid levels is important for the baby. And so many times we will check that TSH value, particularly for someone with type 1 diabetes, before they're planning their pregnancy, and then certainly early in the course of their pregnancy to make sure that the thyroid levels are okay. All right, next question. So, what should people with type 2 diabetes that are living with type 2 diabetes and have thyroid disease do to manage their weight? So I mentioned that an underactive thyroid, you can gain weight. So step one is to make sure that they're getting the right amount of thyroid hormone, and that TSH measurement can tell your healthcare professional whether you're on the right dose or not. And then really weight loss is around lifestyle changes. It's thinking about a specific goal, talking with your healthcare professional of how you might change your exercise. It might be how you look at your what you're eating, And the more specific you can be and real about what change that is, that tends to be far more successful. What change might you make starting tomorrow? So that's the lifestyle part. And then there are medications now that are approved by the FDA that can help people in weight management. Great. We're getting through all these questions, and we're almost near the end here, and answering whatever's in the comments here. Let me finish with one last question. What resources are available to people living with diabetes and thyroid disease or those at risk? And so, the first resource I always point people to is diabetes.org, which is our American Diabetes Association website, has everything related to diabetes, and you'll find some useful information there. Uh, the National Institute of Health also has information about thyroid disease, and that's another uh, good source. So we are wrapping up here. We talked about the link between diabetes and thyroid disease. Uh, we talked about what the thyroid gland is, that it can be overactive or underactive, and what some of those symptoms might be. Uh, we talked about thyroid hormone replacement and how you can monitor that with a TSH value, a blood test. Uh, we talked that it may affect your blood glucose levels, and that for people with type 1 diabetes, they should be screened every year with that TSH blood test for the presence of thyroid disease. And so, wrapping up, I want to thank you for joining. If you found this and the other Ask Dr. Bob's helpful, please tell your friends and loved ones. Follow me on social media on Facebook, LinkedIn, Twitter, and otherwise, I look forward to seeing you next month at our next program. And again, follow on social media when that will be. And otherwise, be well, take care of yourselves, and look forward to seeing you soon. Take care, everyone.